Dear friends from Health and Environment Alliance, apologies for not being with you today in person, and thanks for this opportunity to address a few words. Climate change will transform much of the world over in the near future. Some changes will be visible and tangible, others will be much less physical, but they will affect greatly our societies. Greenhouse effect, extinction of forests. Climate change will have consequences on our health. Desertification, deforestation, erosion of ecosystems, shortage of fresh water will affect agriculture, horticulture, aquaculture, and therefore food security. Rising temperatures and pollution will damage the ozone layer and air quality, causing cardiovascular diseases and hence increasing premature death. Allergies and chronic diseases increase in intensity, and further problems arise from high levels of ultraviolet radiation. All these changes can lead to large-scale migration, as well as outbreaks of disease and pandemics around the world. Societal implications will be very high, especially on vulnerable groups, those who are already suffering from difficult access to healthcare. Social determinants once again prevail and cause social injustice worldwide. Hunger, tropical diseases, just to mention a few. In Europe more specifically, climate change already triggers greater demands on our health services as new infections and allergies appear. This may undermine the effectiveness of our healthcare infrastructure and delivery systems. The scale of the impacts of climate change will directly depend on the actions we take in relation to human, animal, and plant health. Many policies contain instruments that help to reduce the causes of the climate change that affect the health of the population. Using less individual car transportation and more public transport as well as biking, reducing food waste and improving recycling, using alternative energy sources. The existing measures and systems we have in place might need to be strengthened or revised in the pace of climate change quickens. I put hope in the solutions that will be proposed by the COP21 Convention on Climate Change meeting in Paris. The European Union strategy on adaptation to climate change, adopted in 2013, aims to increase resilience of European Union member states to climate impacts. I should also mention the European Union decision on serious cross-border threats to health. This helps strengthen preparedness within the European Union against adverse events, again including those provoked by climate change. Finally, let me say that discussions within the Commission are ongoing as to the further steps to reinforce our approach to climate change. In this regard, the report from the Lancet Commission certainly provides plenty ideas. I wish you all a successful and productive assembly. Thank you.